In the studio with me to talk about the ongoing Malaria Vaccine Implementation Program and concerns raised by some Ghanaians on how safe the vaccination exercise is Dr. Kwame Amponsa Achiano, a senior public health physician specialist with the Ghana Health Service. Good evening and thanks for your time, sir.
Good evening.
First of all, I'm sure what a lot of people would like to know is whether the ongoing exercise is a clinical trial.
Okay, thank you very much. Good evening to your cherished viewers. No, it's not a clinical trial. We've gone past that stage many years ago.
What is it then?
It's called a phased introduction or pilot introduction. What that means is that normally when you have gone through all the stages, before any vaccine or drug comes out, you'd have gone through a lot of stages, including the clinical trials. So once you pass that, you have two options. Either you do a mass scale up, or you scale up, you go gradual. In this case, what we are doing is a phased introduction. In other words, we are piloting, and then we upscale. Why are we doing this? We are doing this because usually children under 1 get vaccination starting from birth. So at birth, 6 weeks, 10 weeks, 14 weeks, 9 months, and 18 months, normally in Ghana. Unfortunately, for malaria vaccine, it is at 6 months when traditionally you don't normally go for, you don't go for a vaccination exercise. So 6, 7, 9, and 24 months or soon after. So it doesn't fit with a routine vaccination system. So you are looking at how feasible is it to introduce such a vaccine? Will the people come through and through up to their very last dose, which is the 4 doses.
Four of them, okay.
We normally don't give 4 doses of any vaccine. So there's a 4-visit kind of vaccination exercise.
And the interval for that is?
6 months, 7 months, 9 months, and 24 months.
Okay.
So it's ectopic in a way. It doesn't fit the system. So you are looking at feasibility. Because if the child doesn't get the 4, they are not likely to have the maximum benefit. So how is it going to play out? What are some of the communication issues? How much will it cost to get a child finally vaccinated, in other words, fully vaccinated for malaria vaccine? And are caregivers going to change their behavior? So there are a lot of questions that you would want to learn lessons from so that it informs your scale up.
Okay.
Otherwise, when you decide to scale up, you may fumble. That is it.
Right.
And then when you are introducing anything into the system, you would also monitor safety, whether it is an established vaccine or a new vaccine. That is standard practice. You monitor safety. So we do what we call adverse events following immunization surveillance, which is done for even all the vaccines that have been introduced in Ghana since 1978. Up to now, we are still monitoring the safety once we are giving it to the general public.
Right. The issue of malaria is a serious one. In fact, malaria kills more people than the deadly HIV/AIDS. So if there is a vaccine that would prevent people, especially children, from contracting the disease, then it's a good one. But here is the case, people are raising concerns. Even before it officially started, we heard on social media and the likes that it's a trial one and all that. This means that you're telling me it's a 4-phase thing. This means that even a lot of people are not patronizing it. What are you doing to allay fears of Ghanaians?
Yes, so we've just started. The launch was done on 30th April. And let me just say that the vaccine is in selected regions because we are doing the piloting. So we've selected some regions and some districts. And so communication is going on there. And we are also, this form of, the invitation to us is also part of the communication exercise that we are doing. There are jingles that are out. We also have made some social media kind of clips, which are going around. Unfortunately, because false news travels faster than good news.
And people have already made up their mind.
Exactly. So it's a bit on the low side. But we hope that with time it will pick up and then the correct information would be given accurately to caregivers and the general public.
So tell me, what are some of the reports you're getting from the exercise since it started?
Well, so far, those of us in Accra have been a bit alarmed. But then when you contact them, those who are actually doing the vaccination are telling us that the mothers are still coming. Of course, they know that there's no way the health system is going to hurt any child. After all, we are there because we want to protect people, and especially for children. That's why some of us even went to school. So our primary aim is to get children well. Interestingly, I remember when we were growing up, we were told that you protect the children and the mothers, the rest will protect themselves. And that's what we are trying to do. Okay.
You're talking about mothers coming in to do the vaccination exercise to get their children vaccinated.
Yes.
Can you give us numbers?
It will be difficult because we just started. Yeah, we started on 1st May. So as at, let's say, day 3 or so, the reports from Brong Ahafo, which is now 3, Ahafo, Bono, and Bono East, and then Volta region. We got information that for even one district we had as many as 52 within 2 days. So for us it's not bad, but we still need to get the mothers understand what we are doing, and then also debunk the myths and misconceptions, and then try and move on as we've been doing since 1978.
Talking about misconceptions, with this particular exercise, there are lots of issues and a lot of eyebrows that have been raised about it. What are you going to do, or what's your reaction to those on social media saying that the manufacturers of this drug have a bad record when it comes to the manufacturing of vaccines?
I don't know about the bad record. I've heard those stories, but I don't know about the bad record that they are talking about.
That's what people are saying.
You see, once a company, you have a pharmaceutical company that develops drugs, there will come a time when some of the drugs will have to be withdrawn and all that. Maybe that's what people are talking about. But it's because we are monitoring even after they have passed for use. You still monitor. And that is why not too long ago, I think we had information from regulators that there were some drugs that we needed to be careful and that we had to withdraw. It's normally when you have introduced in the larger population that you get a very rare adverse or side effects, because if they are rare, the testing is usually done in a few thousands.
Tell us about the side effects. Maybe that's something we need to know.
Well, we normally call them adverse events following immunization. It's not too different from the other vaccines, for injectable vaccines. It's an injectable vaccine.
But
so once you...
this particular
that's what I'm talking about. The malaria vaccine is injectable. So once you inject, there may be swelling. People's immune system will have to react to what you have injected, so there may be fever. It's not everybody who gets a fever. Fever means the body is hot. So those are the common side effects. You may feel nauseated, especially for the older children. They may lack some kind of appetite, but these are transient, which normally disappear in a day or two.
And in extreme cases, what are
so far, because it's a few thousands that normally the trials would be done in, you don't have the very rare ones. It is only when you have introduced in a larger population, where if there's another adverse event that occurs 1 in a million, you use 15,000 people, you cannot detect that. That is why it is so important that when we introduce a vaccine, or even when the vaccine is old, we still monitor, because there may be some rare adverse event that we've never picked up, especially during the clinical trial.
But in fact, you can attest to the fact that all these boils down to safety. People want to make sure that they are safe, and whatever they are being injected with, or their kids are being injected with, is safe. That wouldn't, cause any deaths and deaths. Look into the camera and tell Ghanaians something.
Yes,
just encourage them to do it, and allay fears as well.
Yes, so as I said, we've done vaccination exercise. In fact, we introduced routine vaccination in 1978. And from 1978, we started with 6 childhood killer diseases: polio, measles, tetanus, among others. We've moved gradually. We added yellow fever. We added, in 2002, we added hepatitis B and Haemophilus influenza. So we've moved gradually. Now we are protecting against 13 childhood diseases, vaccine-preventable diseases.
Okay.
Now we have malaria knocking on, and therefore we are very happy that malaria, as we know, is the foremost killer of children. And therefore we are encouraging mothers and caregivers, fathers as well, to patronize, because the health of the children is our primary concern. Nobody would ever hurt a child.
Okay.
Yeah.
Thank you very much. I've been speaking to Dr. Kwame Amponsa Achiano, a senior public health physician specialist with the Ghana Health Service on the ongoing malaria vaccine implementation program. He tells us that the exercise is safe, as in the vaccine itself, it's safe, and it is not a clinical trial as being speculated on social media. So he is encouraging mothers and all parents to send their children to the various centers to get vaccinated.